Hello everyone. Today I am gonna talk about a new medication which has been recently approved by the FDA for the treatment of adrenal insufficiency for children, specifically from age 5 years and older. It's available in oral form and it is easy to administer to specifically children. First of all, understanding adrenal insufficiency. Types of adrenal insufficiency. Primary adrenal insufficiency, which is known as Addison's disease. It occurs when the adrenal glands don't produce enough hormones. Secondary adrenal insufficiency, which is usually caused by the dysfunction of the pituitary gland affecting hormone signaling to the adrenal glands. Symptoms and diagnosis. Common symptoms for adrenal insufficiency include fatigue, weight loss, low blood pressure, and skin darkening. Hormonal testing is important to evaluate the adrenal gland function and assess the hormone levels. Imaging studies also help in diagnosing adrenal insufficiency by providing visual insight on adrenal glands. Causes and risk factors for adrenal insufficiency. Common causes like autoimmune disorders, infections, and specific medications are identified as common causes contributing to health issues. Risk factors like family history, certain medical conditions, and previous adrenal surgery can increase the risk for developing related health problems. Overview of medications for adrenal insufficiency. Corticosteroids and the role. Corticosteroid overview. Corticosteroids like hydrocortisone are essential in managing adrenal insufficiency by replacing the cortisol. Role in adrenal insufficiency. These medications effectively manage symptoms of adrenal insufficiency and improves quality of life. New medication for adrenal insufficiency, especially in children 5 years and older. Kingivi is the first FDA-approved oral hydrocortisone solution for pediatric adrenocortical insufficiency, offering a 1 mg per 1 ml strength for precise dosing. The oral solution eliminates the need for tablet splitting or crushing, providing a ready-to-use option without refrigeration or mixing. Side effects of Kingivi: fluid retention, changes in glucose tolerance, elevated blood pressure, behavioral and mood changes, increased appetite, and lastly weight gain. Administration and dosage guidelines. Dosage for Kingivi. The recommended starting replacement dose is from 8 to 10 mg per square meter daily. Higher doses may be needed based on the patient's age and symptoms of the disease. Divide the total daily dose into 3 doses and administer it 3 times per day. Drug interactions. Kingivi may interact with a lot of medicines like cytochrome 3A4, for example, itraconazole, buzoconazole, voriconazole. It could also interact with some antibiotics like erythromycin and clarithromycin. Also, it could interact with antiretrovirals. Kingivi can interact also with cytochrome 3A4 inducers like anticonvulsants as phenytoin, carbamazepine, and oxcarbazepine, antibiotics as rifampicin, barbiturates such as phenobarbital and primodone, and lastly antiretrovirals as efavirenz. Also, it should interact with estrogen, estrogen-containing products, antidiabetics, anticoagulants as warfarin, cyclosporin and aspirin, and finally non-steroidal anti-inflammatory medications. 10GV during pregnancy and breastfeeding. Tell your doctor if you are pregnant or plan to become pregnant before using 10GV. The use of the required doses of hydrocortisone is not expected to cause major birth defects, miscarriage, and adverse maternal and fetal outcomes. Untreated adrenocortical insufficiency in pregnancy can result in a higher rate of complications, including maternal mortality. The use of hydrocortisone at the required doses for adrenocortical insufficiency is not expected to adversely affect the breastfed infant or milk production. Consult your doctor before breastfeeding. Lifestyle and dietary consideration is essential to maintain a healthy lifestyle for managing adrenal insufficiency effectively. This includes maintaining physical activity and mental well-being. Balanced diet importance. A balanced diet rich in nutrients supports adrenal health and overall well-being. It's crucial to include a variety of food groups. Regular exercise benefits. Regular exercise is beneficial for managing stress and enhancing physical health, which is particularly important for those with adrenal insufficiency. And now we have reached the end of our video. Hoping you enjoyed my video and see you next time. Thank you.